My name is Morgan Gaynor. I'm a genetic counselor at Ironwood, and today we're going to be talking about what it means to be a carrier. When you have cancer genetic testing done here at Ironwood, sometimes it's possible that we can find things that are unexpected or that we weren't necessarily looking for. And that can definitely be true for someone who comes back positive to be a carrier for an autosomal recessive condition. So you may wonder to yourself, what is an autosomal recessive condition and what does it mean to be a carrier for one? But before we can understand an autosomal recessive condition, we first have to understand how our genes are passed down. So to start from the beginning, we all have 2 copies of all of our genes and we get 1 from each of our parents. So to be affected by an autosomal recessive condition, one has to inherit 2 mutated copies of their genes, 1 from mom and 1 from their dad. However, when someone only inherits 1 copy of the mutation and their other one is still working properly, they would be considered a carrier for an autosomal recessive condition, which means that they don't have the condition themselves and they're not able to have this condition in their lifetime. So these findings don't usually have any implications for the patient's medical management. There are a few exceptions to this, however. One example is a mut-YH carrier. For some mut-YH carriers, their recommendations depend on their family history. So for some mut-YH carriers, if they have a parent, a sibling, or a child with a history of colon cancer, then we may recommend that that patient does have colonoscopies every 5 years, starting at 40 years old. However, for the most part, most patients who are carriers don't have any implications for their medical management. However, there are implications for their family members. That being said, a carrier's children, siblings, and parents have a 50% chance to have the same mutation and be a carrier for the same condition. And in general, anyone who's related to the carrier can also be at risk for inheriting the same mutation and being a carrier for the same condition. If anyone related to this patient is considering having kids or considering having more kids in the future, then it may be a good idea for them and their partners to get tested to see if they're carriers for this same condition. And if the relative does come back as a carrier and their partner also comes back positive to be a carrier, then their children could be at risk for being affected by this autosomal recessive condition. Each time these carriers go to have a child, each child would have a 1 in 4 or 25% chance of being affected by this autosomal recessive condition. Bottom line is this carrier result most likely won't have any implications for you, but this info is relevant for anyone in your family who's considering having kids in the future, or if you yourself are considering having more kids in the future. And this info is relevant because it can help someone understand their risk of having a child with an autosomal recessive condition. If you have more questions about being a carrier or other questions about hereditary cancer genetic testing, please feel free to reach out to your Ironwood provider and they can give you a referral to our genetics department. If you enjoyed this video, please visit the Ironwood YouTube page to see more videos like this.